Asthma is a chronic respiratory disease. What should one do to actually control asthma on a longer run?
There are certain measures you can take, but the definitive measure is the treatment, pharmacotherapy, which I previously mentioned, is going to be inhalers.
Passive smoking is worse than active smoker.
Passive smoking is a person who is not smoking himself but is in close contact with somebody who is smoking. See, passive smoker is not going to be more, at risk than, active smoking.
Vaping is a new trend. What's your opinion on it?
People who think they can vape because, it is safe. I mean, it may be safer compared to cigarette, but the bad news is it is still not 100% safe.
What are some tips, if you say superfoods or lifestyle changes that one can adopt in their daily life and take care of diseases like asthma? Welcoming you all to the Poster Show. In today's episode, we understand the power of clean air and healthy lungs with our expert pulmonologist, Dr. Shobitha, who is going to share her experience on how smoking, pollution, and surroundings around us affect our respiratory health. We understand why is it important to protect the air that we breathe in for ourselves and for the people around us. So let's get started. Welcoming you, ma'am.
Thank you for having me.
Ma'am, first we would like to know what is pulmonologist and when should an individual consult a pulmonologist?
So pulmonology is pulmos meaning lungs. So we deal with diseases of the lungs. So lungs are basically two organs which help us in breathing. Okay, so anytime any diseases that affects the lungs tend to cause symptoms like coughing, chest tightness, breathing difficulties. So individual may notice that he's getting these episodes of breathing difficulties, especially while exerting, walking up the hill or a level ground, or certain things like strong smell, dust trigger. So having these repeated episodes of breathing difficulties, frequent coughs, sometimes some warning symptoms like even coughing out blood, chest tightness, and chest pain, fever could also be symptoms related to lung. So any time if you notice, if it's happening one-off, okay, but you're noticing these symptoms come frequently, it may be better to consult a pulmonologist to get a definitive diagnosis regarding some chronic lung disease.
So what are the common respiratory conditions that you've observed and how should one individual actually treat it?
So the common diseases that generally we pulmonologists come across is asthmas, COPD, and some lung infections like tuberculosis and pneumonia. I will deal with each of them one by one. So asthma is basically a disease where an individual breathes the air and there are certain particles in it. So this air is the same air breathed by people who are normal, but when we breathe it, it just goes in and comes out without causing any reaction. Asthma is a condition where the moment they breathe in, their breathing tubes tend to overreact and start causing congestion. So the individual may notice symptoms like when they go to some exposures like dust, allergens, pollens. These are usually what triggers asthma. So the dust allergens, pollen allergens, fungal allergens like the fungus in the wall, and certain even animal danders, they say. So anything that they inhale tends to cause a tightness and wheezing. So these could be the sign of asthma. Treating of it, of course, we'll collectively talk about the treatment together. So now the other common disease we see is COPD. Okay, now this is a blanket condition generally which happens as end result where the lung, same, it is the airways. So like the asthma, even this affects the airways. Just that here the damage is a little bit more permanent, okay, and it's difficult to reverse it. So this usually happens as following exposure to certain, not just these what we talked about previously where all this fungus, pollens, they are harmless per se. Now the exposure is to something which are more harmful, like we look at pollutants. So we have cigarette smoke, okay, here. And even if you see in villages, people use this firewood to cook and boil water. Now these can over a long period of time be as harmful as cigarette smoking. Again, certain occupations like people working in factories of paint factories, sandblasting, they have exposure to a lot of these chemicals like chromium, silica, etc. All these can cause as you inhale. So these generally tend to permanently damage the lungs. So the second common condition that we see is COPD, where the lungs are pretty much damaged by the time we see. Okay, symptoms are again same. They tend to have frequent cough and breathing difficulty. The third and fourth conditions are both infections like tuberculosis and pneumonia. So again, this is caused by a group of organisms, microorganisms, like TB is caused by a mycobacterium, and pneumonia can be caused by multiple other organisms. So what again, when we inhale, these organisms reach the lungs, the body tries to mount a immune response to save it, and in the process you get certain symptoms. Generally these are more shorter, okay, unlike the other two. The other two last over months and years, but these infections generally come in 1 week, 2 weeks, 3 weeks. So maximum maybe over a month or two you see the symptoms. So generally the other two infections have a more short lived symptoms as compared to the other two. So each one will be treated, of course, differently. With infections, we treat them with the antibiotics, and TB is treated with anti-TB medicines. Generally, cure is possible in the last two conditions. The first two conditions, the COPD is difficult to cure, but we can, of course, control the symptoms. Patient can be given a better quality of life with treatment. Asthma can be reasonably well controlled as compared to COPD because they respond very well to treatment. Generally, the treatments preferred is inhalers. So along with that, there are other medical therapies that could be offered. But long-term inhaler therapy is generally the mainstay of managing asthmas and COPDs. Unlike what people tend to believe that inhalers are addictive, they're not so. Inhalers are the primary therapy, and people should stick to regular inhaler use rather than waiting for the disease to progress and get an attack and then puff inhalers, because that's what we see happen. Because people tend to believe inhalers are addictive and then avoid using regularly, and then they end up with a very severe attack. By then the lungs would have been damaged beyond what we can treat. So that's the thing.
Why are lungs different from the other organs?
So yeah, when each organ is performing its own function. So if lungs and heart and kidneys are all different from one another, but lung is probably different in the two major facts. One is it has a lot of blood supply to it. Okay, compared to the other organs, we have a lot of blood reaching from the heart directly to the lungs. This matters at certain situations because it is performing the important function of purifying the blood. So our blood has a gas called carbon dioxide. The main function of lung is to give oxygen and remove the carbon dioxide. That is the reason why it gets so much blood. Second major change it has in compared to other organs is it is one of the few organs which is in direct contact with the environment. So that's not probably the case with the heart or the kidneys, but here you have direct. See, it is necessary because we have to breathe in the air, but the problem of having a direct contact is it is exposed to a lot of changes in the environment that can directly affect it. But of course, lung has its own protective mechanisms. You have the hair in the nose, and there are certain hair-like structures within our lungs which are all aiming to protect it from the environment. So these two make lungs slightly unique from other organs.
Coming to air condition, just to beat the heat, people use air conditioner in their houses. So what are the side effects of using air conditioner on a longer run?
Yeah, I know. I mean, Mangalore heat, we definitely need air condition. So the thing is, see, it's okay to be regularly using, but there are some problems that we need to know, and it may not be a blanket rule for everyone, but certain subsets can have problems. So air conditioned, the air coming from it is obviously cold and has less humidity. Okay, so as it enters, when we breathe it, so the normal natural mechanism of the lungs is to try to heat it up because it has to match the temperature. As it does so, it loses water. Dehydration can happen. This can in turn lead to something we call bronchospasm. What happens is the breathing tubes tend to close and air cannot go in easily. This is not for everyone, but generally people who are prone to lung diseases like asthmatics, those we talked about, COPD, all those who are prone to have lung diseases may notice this very frequently. They frequently say when we sit in AC, we tend to get breathing difficulties. That is generally one of the mechanisms which can trigger. Second general rule for all of us, some problems is, yes, of course, if it is not properly maintained, it could be source of dust, fungi, molds, which can of course cause certain reactions within the lung we call hypersensitivity. So the lung tends to have an allergic reaction, which can again over a period of time make lungs weak. But then that's generally in a not poorly maintained scenario. Again, the poorly maintained scenario, you can even have bacteria thriving in the water, which can be a source of infections and pneumonias. But this can clearly be beaten by having regular maintenance. The other fourth common problem which we can have is, usually these AC rooms are not ventilated. That's a necessary requirement for AC. So the problem with this not ventilated room is the dust, the particles. Okay, people walk in, walk out, they bring dust, the carpets, mats, fungus growing in the wall, or you have even this pipe materials, all those paint materials. They all the things which are coming out remain there. Okay, because there's no fresh air coming in. This over a period of time can lead to something called sick building syndrome. What happens is people tend to breathe this air. Again, same sort of reactions can happen in the lung, which can cause repeated cough, wheezing, chest tightness. This also can be dealt with making sure when the AC is not in use, you can, open the doors, or, if have an alternate window, so that you can at least have it ventilated at times and make sure fresh air comes in.
Could you point out some of the major side effects of pollution on lungs?
So as we talk about pollution, there are generally air, basically it's air that is contaminated with some things which should not be there. So mostly we talk about it in terms of two headings. One is a particulate matter and the other one is toxic gases. See, particulate matter basically is, you can see when the road construction goes on, we just see some particles in the air, dust particles. So not just dust, smoke particles, smog particles, even carbon particles. These are large to small particles that are there in the air, which should not be there. Then we have another category of toxic gases like, nitrogen oxide, carbon monoxide, sulfur dioxide. These should not be there. Okay. So both of them can harm the lungs in their own way. So as we inhale, so obviously we are inhaling this particulate matter and toxic gases. They've damaged the airways over a period of time. The damage leads to, eventually a lot of damages lead to the congestion of the breathing tube. So same over a period of time, these will damage the breathing tubes. They cause a congestion. Air doesn't go in and people tend to cough the phlegm out. So yes, this condition is called COPD. So over a period of time, your pollutants can cause COPD. But the thing is, it's not just limited to the lungs. They can enter the bloodstream, trigger a general body response. They are known to increase the risk of heart attacks, strokes, even cancers for that matter. So all of these can be due to prolonged exposure to pollutants in the air.
Coming to N95 mask, what are the benefits as well as the side effects of wearing the N95 mask?
See, in general, I mean, we did use it a lot during COVID times. For general population, if you are trying to use it for the pollution avoid outside. So, yeah, I mean, see, there are different types of masks. The one we commonly see people wear, the cloth mask. Okay, so cloth mask is good to protect you from, direct large particles that are going. As you're driving, you have particles coming onto your face. Now, cloth masks can protect you from them. But the problem with this cloth masks or the normal surgical masks is they still gap around. So you still can have smaller particles and the gases coming in. Okay. So N95 is probably one step higher because it has 5 layers of filters, and this 5-layer prevents pretty much 95 is because 95% of this particulate matter from coming in. Okay. So yes, you're using it for some time. Maybe it should not cause much of side effects. I mean, using it regularly also for a few hours a day should not be a problem. So N95 definitely can keep out the particulate, the first category that I said, particulate matter, pollutants with particulate matter out. But unfortunately, the toxic gases still will enter. Okay, so it can protect you against the particulate matter in the air, but the gases from the pollutants can still enter and harm the lung, albeit the percentage will be less because you're still, keeping some matter out of it. And side effects, yes, we during COVID time maybe we had noticed it because of prolonged exposures. But if not prolonged exposures, they're generally safe to use. But prolonged exposures for many hours over many days may people have reported to have headaches, feeling of suffocation, mostly because they tend to rebreathe the same air, as what comes out they tend to breathe. And of course some mechanical effects like rashes and acne because of its use. But otherwise, using it for some period should not cause much of side effects.
Does really air purifier purify the air and help us breathe better?
I mean, among the options you have, maybe we can use it. But see, the whole idea or concept of air purifier is good. I mean, what air purifier is supposed to do is, it's supposed to suck in the air from this environment or in your room. Filter, again, run it through multiple filters and, cleaners. And as it pushes out the air, it is supposed to remove the same particulate matter that I talked about. So it removes the particulate matters. It is supposed to filter out the allergens. Okay, even the allergens, those dust allergens, pollen allergens. In fact, some even filters claim to even keep bacteria out. Now, but then the point is the effectiveness depends on the manufacturer, the filters used, the quality, and of course even the room size and the pollutants in the air. But yes, if you actually, under ideal scenario, you have a best purifier, it is definitely going to help, because it is going to keep the particulate matter out, so the pollutants that you are inhaling is going to be less. And for people with allergies, it's going to keep the allergens out. Okay, so the pollens, the dusts are less, so the air they breathe has less of allergens, so the asthma attacks are less. Okay, plus even the respiratory infections which you repeatedly get is less. So yes, I mean, it could, but then a lot of factors need to be considered there before using air purifier just for the purification and preventing lung diseases.
Coming to passive smoker. Passive smoking is worse than active smoker. Could you explain more about that?
See, passive smoking is a person who is not smoking himself but is in close contact with somebody who is smoking, okay, actively smoking. See, passive smoker is not going to be more, at risk than, active smoking. But contrary to what people believe, that passive smoking is less harmful, that's not the case in certain scenarios. See, if you have a spouse or a sibling or a friend who's constantly smoking and you're almost always around, then the risk you have of inhaling is going to be almost pretty much same as active smokers. So passive smoking, you're going to inhale the same, particulate matters and smoke, the toxic gases. So the eventual damage to the lungs and the blood circulation related adverse effects, like we talked about heart attacks, all these pollutants cause. So the risk is going to be pretty much the same. Okay, so may not be worse, but it is going to be same, or sometimes, yeah, if it's not regular, it could be less. But then nevertheless, they are at risk. So passive smoking is also a bad idea.
How many years does an active smoker actually take to show the symptoms of the lungs getting infected?
So, see, active smoking depends a lot on how much he smokes, but active smoking has been shown to start, showing symptoms as early as 5 years. Okay, so if somebody smokes 1 to 2 packs per year, after 5 years of smoking, people have, studies have shown that there is 25% chance of developing lung symptoms. That is 1 in 4 smokers. Okay, so that's quite a high percentage. The earlier symptoms, though, maybe just having simple cough, early morning cough is generally what we say, typical smoker's cough. So it may start off as initial harmless cough. Okay, but over a period of years, the prevalence, so from 25%, it keeps increasing as the number of cigarettes smoked and the duration increases. Then it can go to a full-blown COPD, where patients not just have a harmless cough, now they are having breathlessness, difficulty in doing daily activities and exertion. Okay, that later can again progress. We have, as duration goes, so somewhere we have almost like 20 pack years. So that means that if somebody has smoked 1 pack for 20 years, then comes the lung risk. Okay, so we start off with a simple cough, then go to a COPD kind of condition, and then comes the lung cancer. So there's no exact timeline, because some people say that we have smoked so many for many years and they don't develop lung problem. Okay, it's not a hard and fast rule, but generally, yes, the ones who are at risk, where we have other factors coming in, but can develop symptoms as early as 5 years. That's what, at the end of 20 years of smoking 1 pack, you are at 40 to 100 times higher risk of developing lung cancer as compared to somebody who has not smoked. So that is quite a high percentage.
Coming to pregnant women, why pregnant women are advised not to smoke?
So the same harmful effects that we talked about on the lungs, okay, and the blood vessels holds for pregnant women. But unfortunately, here they have an additional pregnancy to worry about, and their unborn fetus. So other than the lung effects, they even have problems of their delivery related complications. So pregnant women who smoke are at higher risk of bleeding during delivery. Okay, which is not a which is a dangerous complication. More bleeding can risk the life of the mother during delivery. Second thing that it can do is lead to placental abnormality. Now placenta is a tissue which carries the nutrients from the mother and gives to the fetus. Now having this abnormality will compromise on the fetus well-being too. Third complication we commonly see is early delivery. See, delivery has to happen after a specified period of time. Having an early delivery is bad for the mother and the baby. Baby, because it's not ready to come out. So if the delivery happens early, they are, it's a preterm delivery is what we say. It's a risk for the baby, because its lungs and organs are not developed. So preterm delivery is also found to be higher in pregnant women who smoke. Other than this, there are a lot of adverse effects for the fetus. So other than the pregnancy related things, the fetus itself, the growth, like we said, the nutrient going to the the baby is compromised. So fetal growth is affected. It may be smaller for its age. Organs are not very well developed. There can be birth defects. The fetus can have abnormalities in its organs. Similar, lung can be affected. The lung development can be affected in the fetus too. And unfortunately, even studies have shown some stillbirth, that is unexplained death of fetus too in the uterus.
Coming to kids, what are some of the most common issues that you see related to them?
So the respiratory issues in kids is a little challenging to diagnose, more so because, see, the first 4 5 years, these kids tend to have repeated infections. In fact, it is so common that they say having 4 to 5 respiratory infections in kids is common. Okay, so they tend to have this, and whenever they get these infections, we notice they go very prolonged. It's called as viral wheeze. So they have a prolonged cough, prolonged wheezing episodes. But then again, that is considered to be normal for them. So when do we really actively intervene and diagnose them to have things like allergies, asthmas is one challenge. So second challenge is they have certain category of diseases that comes only in kids, like you have developmental abnormalities. They may have some the lungs may not be well developed. Okay, they may have some immune deficiency disorders. This group of disorders generally happens only in kids. So the challenge what we normally face is the same. So kids tend to have cough commonly, but there are other set of diseases we need to consider. So when do we think it is okay? When do we think it's serious? Is challenging a lot of times. But nevertheless, after 5 to 6 years, we generally we don't expect them to have the frequent symptoms. So beyond this age, when it is happening frequently, I guess we need to consider other diseases like asthmas in them, or some other pneumonias, infections, TBs. So the challenge comes in the younger kids.
Vaping is a new trend. What's your opinion on it?
So yeah, I mean, for people who think they can vape because it is safe, I mean, it may be safer compared to cigarette, but the bad news is it is still not 100% safe. So the concept of vaping is it's e-cigarette, so electronic device which in place of fumes gives you vapor. Okay, the vapor obviously comes from heating a liquid called e-liquid. Now the issue is this e-liquid itself has chemicals. Okay, so it's not like it's a water vapor that is safe, you can just inhale and there's nicotine in it. Unfortunately, the e-liquid also has chemicals in it. So it has one chemical is called glycerine. Okay, now that is known when you inhale to cause a type of pneumonia called lipid pneumonia. The other content, nicotine, of course, is known. It is what is there in cigarette smoke. It is the addictive component of it. The third problem is having certain flavoring agents and chemicals there. Even they are known to have certain flavoring agents. And in fact, some chemicals of cigarette smoke are also there. Okay, so albeit the content is very less, but they still have the same similar composition. So it can harm, not to the extent of cigarette smoke, but it will still. So vaping is not probably 100% alternative to quitting to smoke. And of course, other than that, the same addiction that cigarette smoke can cause, vaping also can cause, because it has the nicotine content. So you are having similar, less exposure, but over the long run, the safety of it is known. That's why actually it has not been used. I mean, medically it is not used as an alternative yet to de-addict people from cigarette smoke, because even vaping is said to be harmful.
Coming to scented candles, the trend of scented candles running across the globe actually. What are the side effects of those chemicals on our lungs?
See, again, so maybe one of use should not be a problem, maybe few, but yeah, why you're using once in a while should be, but yeah, regular usage, again, like any, fumes, and you have chemicals here. So the wax, you have wax and a fragrant added to it. That's basically what a scented candle. So you have adverse effects of candles itself. So when this candle and the fragrance burns, you have most important chemicals called volatile organic compounds. Okay, these compounds are known to irritate basically the airways. So they irritate your eyes, they can irritate your nose, they can irritate your lungs. So of course this irritation can cause redness, can cause you to have sneezing, can cause you to have same congestion that you have. In fact, some of the VOCs, like one content called formaldehyde, can even cause lung cancers. So, but yeah, again, the quantity of this will be much lesser as we are talking about the other pollutants, but it is again not safe to be used regularly. And this is not the only thing. Again, the fragrance that we have, they are also said to have many chemicals. Chemicals can cause systemic effect. So what we talked about, VOCs were limited to the lungs, but some of these chemicals can get absorbed into the blood. Once they reach the blood, they can, cause systemic, what means this generalized body response. This body response can cause things like, having migraines, having headaches, and yeah, that's pretty much the thing.
Coming to poor breathing, what are some of the consequences one has to face due to poor breathing or poor lifestyle?
So poor breathing technique, I assume, is, breathing shallow. So the problem with, see, every time we breathe in air, there's a set volume that we need to take in. Okay, so this volume we call it as tidal volume. Okay, that is the normal volume that we normal person unconsciously breathes. This volume is what, gives oxygen, kind of carries oxygen. Oxygen is removed from the alveoli, that is the part of the lung that, performs the function of gas exchange. So the oxygen is taken from the alveoli, given to the blood, and from blood carbon dioxide goes out. Now you are having repeated shallow breathings, naturally the amount of volume of the air that you're taking in is less. Okay, so of course there may not be an overtly visible problem, but then see, over a period of time you're going to find yourself more lethargic, because see, the air and oxygen that is, reaching is going to be lesser than what would have happened if you had taken a deeper breath. So period of time, letharginess, fatigability, not being able to exert is all going to be there.
Is there any general tip which you could give one to take care of their lungs on a longer run?
See, general tip, taking care, see, most importantly, among all this, what we discussed, the preventable one was only COPD. Okay, so of course, trying to keep these pollutants out. I know pollution keeping out is easier said than done. We have seen what's happening, in some cities. So, but first, what we could really prevent is smoking. I think cigarette smoking is the number one thing which you can actually do to protect your lung. Any forms of cigarette smoking, active, passive, vaping, or anything, probably even hookah for that matter, all those things are better avoided, because that cigarette smoking is totally under our control. Okay, see, people who are cigarette smoking, who are addicted, there are medical facilities, to help you de-addict. So if you're already addicted, there's no worry, you can always seek medical help, take de-addiction measures, because there are medical forms of therapy to help. So one which is definitely under our control is avoiding, smoke related pollutants. Of course, general pollution, if it is under your control, maybe yes, we have to, try to reduce the air pollution, though that's a little difficult said at an individual level. But at collective level, it has to be something that is dealt with, okay? Because reducing air pollution is also the need of the hour, because whatever measures we say, plant trees, use carpooling, whatever, but has to be considered in the long run. Third thing probably, which, see, again, occupational exposures. So some occupations are at risk, okay, now where they are factory related jobs where they know they are exposed to these chemicals. There are protective masks, the professionally available protective masks, which are, having filters. So using these masks at workplace can reduce the contact that you have with these chemicals. So of course, that is the third thing. Then yes, again, your diet. Okay, see, having a mixed balanced diet. So a mixed balanced diet is generally one which is rich in proteins. That's good for lung in the sense that it helps the muscle building and also improves your immunity. Having iron, calcium, and other nutrients also in the diet, and some antioxidants. So antioxidant is a new thing. Generally, people are talking about having antioxidants in the diet because these are supposed to protect from the harmful, chemicals in the air. So oxidant related foods are usually our citrus stuff. So vitamin C and vitamin E related foods. So having a balanced diet, having all these nutrients, and physical exercise. Okay, see, because obesity, gaining weight, is a known risk factor to a lot of lung diseases. Most importantly, asthmas and sleep apneas. Okay, so these two asthmas can happen even in non-obese, but obesity increases the risk of having a severe disease. So yes, looking at weight, controlling the weight could also help in, improving your lung health.
Are there any general tests which can be performed regularly to take care of your lung health?
See, tests, yes, there are tests. I mean, first we would want you to look at your symptoms. Okay, symptom screen yourself. Do you frequently find yourself coughing? Do you find yourself not able to exert or walk, which you were previously doing? Okay, so are you able to exert and walk? And like all the warning symptoms of, fever, weight loss, none of those symptoms are there. Yes, you can do a screening test. There is lung, we do a test called lung function test. Okay, this lung function test is basically a test which can uh, check your lung power. Individual is asked to blow into a machine forcefully. When they blow, the power which they blow is known. So with that power, you can assess if it's normal for his age. This doesn't pick up all lung diseases, but the primary ones like asthma and COPD can be picked up. TB and pneumonias and other lung diseases will probably need a specific scenario, but spirometry, which is the lung function test, would be a very easy bedside kind of test to check for your lung health.
And how often can one do it?
See, that's a not it's a test with no radiation exposure, so technically you can do it very frequently, but I would probably recommend if you have a risk factor. See, anyone, it's not useful to screen per se, okay, but see, you have a known risk factors, you are in the occupation where you have exposures, and you are already a smoker. In that case, maybe doing it once in 6 months to a year to check your lung function decline would be ideal.
What is the best exercise that you would suggest to maintain the lung health at its peak?
See, exercises which help the lung and the heart in general are going to be aerobic, okay, where you have this heart rate going up, on oxygen demand going up, and of course your lungs is able to provide it, okay. So any of the aerobic exercises can be taken into account: walking, running, cycling, swimming. They're all okay. There's no set specific duration which is good for lung health, but doing this regularly, maybe half an hour to 1 hour a day, should be good enough.
Lung cancer. What are the initial symptoms of lung cancer, and how does one actually develop those symptoms on a longer run?
See, so lung cancer is basically a disease, what we mean, a cancer of the breathing tubes and the alveoli, which we talked about. A lot of times, though, symptoms happen late in the disease. The early symptoms, though, you see, that's the problem with the lungs. The symptoms are cough and breathing difficulty, which tend to overlap everywhere. Okay, so the warning sign of lung cancer will also initially, even lung cancer will begin with a cough only, unfortunately. So it begins with coughing, breathing difficulty, similar to any other disease. So maybe we would suspect it in person who has a risk factor. So somebody knows they have a risk factor, for example, like we said, cigarette smoking, occupational exposures, family history of lung cancer. So if you are, that's what, pollutant exposure. So if you have any risk factors for this, and generally we see it after 40 kind of years. So if any of these symptoms are coming after that age, okay, and you're at high risk for developing it, probably screening for it would be ideal. But otherwise, there is no such symptom that you can say symptom is of lung cancer. Okay, cough and breathlessness. Coughing out blood, though, is generally one of the symptoms that we really worry about, is coughing out blood, though it can happen with TB too, but hemoptysis is what we say. This symptom could be a warning sign of lung cancer. So if somebody has a risk factor and he tends to cough out blood, there may be a sign of lung cancer. But like I said, there's no sign or symptom which you can say is 100% lung cancer. It's going to be the same 5 symptoms overlapping with one another.
Asthma is a chronic respiratory disease. What should one do to actually control asthma on a longer run?
So asthma is a disease, like we said, it happens due to overreaction. So to control, there are certain measures you can take, but the definitive measure is the treatment, pharmacotherapy, which I previously mentioned, is going to be inhalers. But other than that, there are other therapies. One is, if you could avoid the allergens. If some individuals know what they're allergic to, try to avoid it. Okay, it's easier said than done, because the common allergens are going to be dust, pollens, and fungal in the wall, which is not very easy to avoid. But there are certain house measures, because usually these allergens are found in home environment. Okay, it's within the house. So some simple measures that are suggested generally is using vacuums with HEPA filter, because these filters again keep your dust and allergens out from the environment. Otherwise, keeping the humidity of the air in the house low. Third is the bed sheets, because the commonest allergen is the dust mite. It's usually found in the mattresses and pillow covers. So it is recommended to wash the bed sheets and pillow covers once or twice a week in hot water to get rid of these mites. So some simple things like this may help, but of course they won't be the primary therapy. But reducing your allergen exposure at home can be one. Sticking to the medicines, what we said is the inhaler devices and other tablet medications which are available regularly, and not waiting for an attack to happen, is the second. Third recommended treatment is generally, the thing is vaccination. The Thing about vaccination is like we vaccinate kids to protect them from infections, we can do the same for respiratory infections, because every time the asthmatic gets a respiratory infection, his lung function goes down. So there are respiratory vaccines like pneumococcal and flu. They can regularly get themselves vaccinated. Yeah, these are some of the measures that can be taken to make sure that your asthma doesn't progress. Okay, stick to medicines, avoid allergens if possible, get yourself vaccinated. And we have something called immunotherapy, where we can, if we know one specific allergens, we can desensitize
Are
them to
there
that.
any home remedies which you would suggest, or some certain precautionaries which one can take?
See, home remedies, like I said, it is not really a remedy, but the only precautions at home will be to reduce the allergens. Okay? Home remedies can be added, but primary therapy is going to be primary. You cannot be replaced by the home remedies.
What is bronchitis? How is it different from asthma?
So the bronchitis is the air that we go when it goes into the breathing tubes. Those breathing tubes are called bronchus. Now, any damage to that bronchus will cause an inflammation. So inflammation is basically body's response to the damage, because body is meant to protect us. The moment anything is damaged, it starts a protective response. That protective response is inflammation. So bronchitis is nothing but the inflammation of the breathing tubes. Now bronchitis has a lot of causes, and asthma is one of them. So asthma is different from bronchitis because bronchitis can even happen because of infection, where we call it as a viral bronchitis. Okay, it could be because of that smoke and pollutants that we are talking, in which case it becomes a COPD. So asthma is one cause for bronchitis, but there are many other things which can cause bronchitis.
What is tuberculosis? What are the initial symptoms for it? And what are some of the tests which can be taken to regularly supervise the tuberculosis?
So tuberculosis is a lung infection. So we have this bacteria called Mycobacterium tuberculosis in India, which is highly prevalent. So it probably is there in the environment as we breathe. So what happens is, when you breathe in this bacteria, again the body mounts an immune response. In a lot of us, the body manages to fight it and contain the infection, but few people end up developing the infection because the bacteria is stronger than the immune system. So tuberculosis is basically an infection of the lungs by this bacteria. Okay, so the symptoms of TB include any symptoms of infection. So these people tend to have fever on and off. Generally the fevers are low grade, tends to come in the evening, and the marked symptom is usually loss of weight and loss of appetite. TB is one such infection which causes significant loss of weight and loss of appetite over a short period of time. So that, and with other symptoms of lungs like cough, breathing difficulties can be there.
What is the typical course of treatment given to a patient suffering from tuberculosis?
So the thing, the diagnosis. So first thing, how would we diagnose? So when individual will has presented with any of the symptoms, we generally attend to suspect TB in anyone who has cough more than 2 weeks. That's just generally government guidelines to suspect in anyone who has more than 2 weeks. So when an individual who we think has a suspect to have TB, the common test that we do to diagnose is a sputum test. They tend to produce phlegm, and this phlegm will have the bacteria if they are infected. So the phlegm testing is the test, generally is the test to confirm the TB. Okay, but sometimes yes, we do miss the bacteria in this phlegm, in which case we may suggest doing tests like CT scan or a bronchoscopy kind of invasive test. But generally most of the times TB is diagnosed with the phlegm testing. See, we don't do it regularly, in the sense when you suspect it, you do it. Okay, once it is diagnosed, it is it is purely, it's a curable disease, unlike what people get scared of. Okay, there's a lot of stigma attached to TB. Unfortunately, it is nothing but a lung infection, and it is 100% curable generally, as if you stick to the therapy. Most of the times people fail to stick to the therapy. The reason being, it's a long treatment. See, most of the other antibiotics you take for 5 days or 10 days max and it's done. Here the treatment goes on for 6 months. Okay, that is in one specific most common type of TB response, we call drug sensitive TB, response in 6 months. But there are certain variants of TB like drug resistant TBs, where the treatment may go on for 1 to 2 years also. But we will stick to the common ones because that is the common one. The common TB is drug sensitive TB, which usually requires only 6 months of therapy. There will be 4 types of tablets given. First one being for 2 months, and then the dosage is reduced, and for 4 months it will be continued. Usually these medicines are safe, but people tend to have certain adverse effects like vomiting, and joint pains and all, and that's the reason why people frequently tend to stop taking it, and that is actually the reason why TB doesn't get cured. So I think for people who are having and taking, they need to realize that each of those adverse effects can be managed. They just need to consult the doctor, get medicines for the adverse effect, and if the adverse effect is very severe, there are alternatives. Okay, so TB is a disease that should be cured, and I think it is a lot of in media light. I think our Prime Minister wants us to get rid of TB, but we still have a long way to go. Hopefully we'll do it.
How much time does one take to recover it fully?
See, the improvement starts within 2 weeks to 1 month. Full recovery is difficult to pinpoint, but 6 months is generally, that's the reason we think that the bacteria is 100% gone only after 6 months, and that is the reason we ask them to continue for 6 months. But the symptom improvement will be seen as early as 2 weeks to 1 month.
What are the early signs of COPD, and when can one tell that he or she is at risk?
So the risk is going to be the same what we have been telling about, what I just told, like the smoking, pollutants. So an individual who is at risk for having like all the risk factors, he's been exposed to the risk factors. If the person finds himself frequently coughing, frequently breathless, so walking up the hill or walking up the stairs is making you breathless, you feel the chest, patient feels the chest is tightening, and air hunger, like we say, they have to stop for breaths in between, walking on the level ground, playing sport activities are making them breathless, and they have a known risk factors, they could think or consider themselves to be at risk, meet the doctor. We do perform the spirometry, like we said, the lung function test. It can pick up COPD at a very early stage because lung function declines in patients who have COPD.
Coming to pneumonia, what is the main cause of pneumonia, and does age factor actually play a role in that?
Pneumonia can come across any ages. So, like we talked about TB being one infection, pneumonia is also another infection. It is different in that it can be caused by a lot of other microorganisms. So we have viruses, we have bacteria, we have fungi, we have parasites. Now any of these enter the lungs and they infect, we call it to be pneumonia. Now the first two organisms, viruses and bacteria, common across all age groups, okay, because the kids can get, adults can get, any age can get. But the last two, the fungal and parasites, and they tend to happen only in certain specific sets of people. So pneumonia is basically a lung infection which can happen in any age, but the only thing is with age there is certain change. Older the age, the risk of getting a severe pneumonia is more. Okay, so that way it would be different. Just that the risk of them getting and us getting is the same, but the older the age, they may have more severe disease. It can even be life-threatening at times. So age can play a factor in the fact that it can increase the risk of developing a severe pneumonia. But otherwise, pneumonia can be seen across all ages.
Coming to pulmonary hypertension, how is it different from blood pressure?
So pulmonary hypertension, as I previously mentioned, the lungs have a lot of blood supply from the heart. In fact, one chamber of the heart is meant only for the lungs. Okay. So now if the other hypertension we talk about is a systemic hypertension. Now here, it is the blood pressure of the other organs going up. Pulmonary is when the pressure within only the lungs goes up. Okay. So this is different from systemic hypertension in the fact that it is not very easy to pick. Okay. Because there is the only test that can pick up a pulmonary hypertension would be a echo scan. So we'll have to suspect it to do it, because it's not like a routine blood pressure cuff that will measure it. So the increased pressure within the pulmonary arteries is pulmonary hypertension, which needs certain advanced techniques to diagnose. But here the symptoms are also different. So systemic hypertension may present with headache, bleeding from the nose. Sometimes there won't be symptoms at all. But pulmonary hypertension tends to have symptoms. They usually again patients start noticing that they feel breathless. Here you don't tend to have cough and other symptoms. Generally the striking symptoms of PH is breathlessness while walking. So patients, when they walk in the level ground or uphill, they start noticing that they have to stop for breaths very frequently. So that and other symptoms that could happen is leg swelling. People tend to have both the legs swollen commonly in PH. So and PH, unlike systemic hypertension, has a cause. Usually pulmonary hypertension happens in patients who have a chronic heart disease or chronic lung disease. It generally doesn't happen to anyone. Like systemic hypertension has a much higher prevalence than the pulmonary hypertension. Pulmonary hypertension fortunately has a smaller subset. Okay, it can happen only in some people. in contrast to the systemic hypertension.
Can diabetes lead to pulmonary diseases?
Yes, definitely. Diabetes is a risk factor for actually lung infections, the pneumonias and TBs that we're talking about. See, what is diabetes? You have more sugar in the blood. So the more sugar makes the bacteria thrive. So these people tend to have more infections. So respiratory infections keep coming, and they even notice them to be more severe. Okay, hospitalizations more in these people. Prolonged antibiotic therapy is also more. So diabetes causes frequent lung infections and more severe lung infections. Of course, the latest studies have shown that even diabetes can damage the lung, but it is not that common as the other two complications which we frequently see in diabetics.
How is sleep apnea affecting the pulmonary diseases?
So sleep apnea is a subset of respiratory diseases. Basically, what happens is when we sleep, no, everyone sleeps. We have muscles relaxing, especially in the one phase called NREM. So when the muscles of the body relax, the same happens to the breathing muscles in the throat. So as the breathing muscles relax, there's a bit of closure naturally, okay, because here the muscles are open. When they close, they will tend to collapse. See, normal individuals who don't have sleep apnea, the collapse is not much. Air still goes in. So when this thing becomes smaller, air will still go in. But the individuals who have sleep apnea, unfortunately, the closure is so much that air doesn't go in. Okay, so that's why in sleep, they may find themselves waking up frequently. Okay, they don't realize what, but they find themselves, suddenly they feel like there's a choking sensation. They wake up, they take an air, and then go to sleep. So having frequent, choking sensations, frequent night awakenings, not having a refreshed sleep in the morning because of this frequent cuts in sleep. People tend to not be refreshed in the morning. Okay, so early morning headaches are possible. That letharginess in the day, because it's like they've not slept every day for many days, so not having a good night's sleep can affect. So these kind of symptoms can happen in patients with sleep apneas. Again, sleep apneas have certain risk factors. Generally, they are very common in obese people, and the other risk factors include people with certain anatomical abnormalities. So some people tend to have a smaller jaw, larger tongue. Okay, because its main problem in the throat level, at the throat and level. So not at the lower airways. The apnea here happens because of a block in breathing tubes at a higher level. So again, people with if alcohol abuse and sedative abuse can also lead to sleep apneas. So these symptoms can happen. If you notice, if any of these symptoms are noticed in people with risk factors of sleep apnea, they need to, snoring is the other one. So any of these symptoms are noticed, they need to seek medical help, because we can do something called sleep study, and the disease can be diagnosed.
How does untreated sleep apnea affect the overall health?
So, as I mentioned, the sleep apnea is where the air is not going into the lungs, okay, because of the block here. So, obviously, air not going in means less of oxygen, okay. So, it happens very transiently. It's not like it's going to happen through the night. It happens for few seconds, and then it corrects itself, and this is happening over multiple, times in the time through the night. So this repeated episodes of oxygen, again, immediately will not be showing any signs or symptoms, but over a period of months, years, people tend to have complications. The most common complication that we get is because of this low oxygen levels. There is a systemic inflammatory response. Again, the inflammation that I was referring to is a body's protective mechanism. So inflammatory response, which tends to cause mostly a lot of cardiac adverse effects. In fact, it is said to be very bad for the heart. Okay, it increases the risk of heart diseases significantly, sleep apnea. So the heart complications we commonly tend to have is they are at high risk for heart attacks, high risk for heart beating abnormalities. We call it as arrhythmias. Okay, so their heart beating tends to be very irregular. And again, our PH, the pulmonary artery hypertension, can also happen in these patients. So over a period of time, obstructive sleep apnea is very bad for the heart, and the risk of heart diseases is much higher in these people.
HOBT therapy. Could you explain us about it?
So HOBT is hyperbaric oxygen therapy. Okay. So what happens in this is individual is put into a chamber where, see, what air we breathe is 21% oxygen, and it's at atmospheric pressure. Now when they are sitting in this hyperbaric oxygen room, the oxygen is also 100%. That means they are not breathing any other air, and the pressure is also very high. So why would we do this? Okay, so this is done in very specific scenarios. One is in scuba divers and sports space shuttlers. What happens is when they have rapid, scuba divers, when they tend to rapidly come up, or space shuttlers are also rapidly moving, the changes in pressure, okay, causes certain air bubbles to form inside, because ideally they are said to come very slowly, they should come slowly, but if they end up coming, they could have certain consequences of, rapid changes. So this air bubbles can be removed only by hyperbaric oxygen. So when they are put into this chamber, the high oxygen content and the high pressure tends to push the air bubbles out. So that is one scenario where we would use. There are certain newer scenarios where they're using, especially more oxygen, they say, for the tissues, helps in tissue healing. Okay, tissues getting better oxygen. So they have, it has been tried in, healing of wounds which are taking a lot of time to heal, or even radiation in induced injuries. Okay, so if individuals have wounds that are not healing, giving too much oxygen for short period of time, again this won't be very long, short period of time can help.
Is it true that only smokers get lung diseases?
No, that I think we just talked. So smokers are at very high risk for developing lung disease, but it's not true that only smokers will get. So even for lung cancer, for that matter, there are many people who come and tell us, "Oh, I don't smoke. How did I get lung cancer?" So it is known that even non-smokers can get lung cancers. Okay, so they just get a different type of lung cancer. Smokers have one type, and non-smokers are different type. Again, the risk is lesser, but it is known. Okay, and non-smokers can again get asthma as can happen to anyone. Okay, so TB and pneumonia is also, so a lot of lung diseases actually can happen to non-smokers. Risk factors include genetic factors to some extent, your body's immunity, having other diseases like diabetes, which we talked about. So it is not true that only smokers develop, but yes, smoking is definitely harmful to the lungs and increases the risk, but even others can get lung diseases.
What are some tips, if you say superfoods or lifestyle changes that one can adopt in their daily life and take care of diseases like asthma or any pulmonary infections?
It would be, see, the asthma is, the risk factors for asthmas is, exposure to the allergens that we talked about, and genetic. These two are not very much under our control. Uh, to some extent, controlling asthma with diet would be a little, difficult. But yes, here the oxidants that I mentioned are said to play some role. Having more oxidants in the diet could help, but again, it's not a primary thing. But pneumonias and TBs are known. Having a good protein-rich diet improves your immunity. Having a balanced iron, calcium, and all the micro macronutrients in the diet will improve your body's immunity. So the infections can be kept at bay. Oxidant levels in food can reduce your risk of probably getting, chronic lung diseases. They have some anti-inflammatory property, okay, but they would not be the sole, reliable factors in the thing, in controlling lung diseases.
What is the message that you would like to give to our society currently having the sedentary lifestyle and the pollution, the air that we are living in?
Yeah. So sedentary lifestyle, I think I can advise, but pollution, I think it's at a more, political and, at a larger level. Though I would really, want to have, breathing an air that is not polluted, but it's very difficult. Pollution is, but at our level, maybe yes, we can consider, right? Carpooling, maybe, huh? Having more trees, at least in your surroundings, if you can. So maybe at our level, try to, do something for the air pollution. We can't just keep pointing fingers at the government all the time. They are supposed to take up, but then, yeah, from our side, using less of, if you're going to shop for something very nearby, rather, walk or, cycle. Why use car for it? So from our side, at an individual level, try to reduce the use of things which are known to pollute the air. So have less of car use if you can avoid it, and yeah, burning, if we tend to want to burn things, just look at alternatives, to, rather than burning some waste. If you have any alternative, better alternative. Sedentary lifestyle definitely is bad for the lungs and in general well-being. So having daily regular exercises, preferably aerobic, for half an hour to 1 hour, watching your weight, not gaining weight, is a definite need for the hour. Because with obesity, not only lungs, we get a lot of lifestyle diseases. You get diabetes, you get metabolic syndromes, you get heart diseases, yeah, sleep apneas. You can just, the list is endless. So sedentary lifestyle is not a good thing. See, excuses you can give, but I think it is your health. You have to take it into, consideration, and make sure that at least half an hour or 1 hour of exercise can be fitted into your schedule.
I hope today's episode gave you the in depth analysis of your lungs and it will inspire you to take some steps to live in a cleaner environment and keep your lungs healthy. Until next time, stay healthy and keep joining to Poster Show.